Okay, awesome. So welcome everyone to our workshop, Stepping Up for a Healthier Stockton. So as kind of an icebreaker, let's do a quick check-in in the chat. I see some people already said how they're feeling. Would you also be able to share if you had to pick one superpower, what would it be?
I think that is everyone who answered. Did you want to go ahead and start the presentation?
So hi everyone. My name is Malia. I am a student at UC Davis. My major is genetics and genomics, and I have a minor in public health. I'm not sure why my picture isn't showing up, but that's okay. You can see me here. Yeah, go Ags, and I'll pass it off to Malia.
My name's also Malia. I just graduated from University of the Pacific with biological sciences and pharmacy. Malia and I, we share the same name. We also share the same interests. We both love to make art, and we're both youth advocates for the Dawn program here at Little Manila.
Okay, so we're going to start with a quick brainstorming session so we can become more in touch with what the biggest health issues in Stockton are. So next slide, please. We're going to create a word cloud. So if you can, please either scan the QR code or go to that link or go to menti.com and type in that code, and it'll let you put as many options as you want for what you think the biggest health issues in Stockton are. Okay, so the word cloud is going to show like the words that are in the biggest font. Those are the responses that were given most often. So those are the ones that you guys thought were more of a health issue. So we have heart disease, pollution, skin disease, lungs, which goes with asthma pretty well. We have asthma, diabetes, cancer, anemia, investment, and redlining. So thank you all for those responses. Oh, someone wants to add mental health access. Definitely, that's a big one. Okay, so these are the biggest health issues or some of the biggest health issues in our community. So a lot of these were noted in the word cloud. So we have asthma, diabetes, mental health, obesity, behavioral health, and chronic diseases. And next slide, please. Okay, so on the map on the left, that's a map of San Joaquin County. And all the little red boxes you can see, those are priority neighborhoods. That means that those neighborhoods face greater health challenges. And because of these challenges, they also have greater health needs. And some of these health needs are what we just talked about on the last slide and with the word cloud, like asthma, diabetes, mental health. But we also have other health needs like violence and injury prevention, having access to care, and even oral health. Unfortunately, most of the priority neighborhoods, like you can see from the map, are in Stockton, but it also makes sense when you think about how Stockton is a major population center, and most of the people who live in San Joaquin County do live in Stockton. And it just kind of goes to show how much we need to be addressing Stockton's health needs.
As you can see from the yellow chart on the right that Malia just spoke about, you can see the 7 least healthy census tracts as of 2020 in the San Joaquin County. The top 7 are all in Stockton. Tract number 1 is San Joaquin County's least healthy census tract. And if you think to yourself, where do you think this tract possibly can be in Stockton? If you want to, go ahead and throw it in the chat, unmute yourself, whatever you want to do, if you want to take a quick guess. Okay, this is a direct screenshot of Census Tract 1.01. We labeled 2 of them as 1, that's 1.02 right next to it. So as of 2020, Census Tract 1 is right by the freeway and the marina. This is the least healthy in all of San Joaquin County. About half of the population here were born outside of the US. Less than half of the people here have graduated high school. And household income on average is only about 3/5 of what the rest of Stockton makes. And if you were wondering, that's about $30,000 per household. The surrounding tracts around Tract 1 are some of the other top 7 least healthy tracts in San Joaquin County. Surrounding Tract 1 are the other top least healthy tracts in San Joaquin County. You can see 3, 6, 7, and 16 are all right next to each other.
As we can see from that map and everything, those are all health disparities that are present in Stockton. And this chart, it's on the social determinants of health, and it can help us understand why. So some of these might be a bit self-explanatory, but like at the very top, we have social support. So if someone's going through a tough time, they have a better chance of staying healthy through that if they have good social support, or if they have stable access to food or housing. And if someone works a job, a desk job, they may be sedentary and not get that much exercise. But someone who works in construction might get enough exercise, but they also carry a much bigger risk of injury on the job. Either way, their job affects their health, and that's kind of the same story for all of these factors here. The quote at the bottom really shows this, that everyday conditions in which we're born, live, learn, work, and play have a significant impact on the health of individuals, families, and communities. Another example of this is how someone who lives right next to an industrial area or a freeway, as we can see in Stockton, they're more likely, unfortunately, to have worse health than someone who lives like close to a park or lives a short distance from a doctor's office, so it's easier to make it to appointments. And this chart is kind of the same thing, just it goes into more specific topics. So one really big one is health literacy. So if you get test results from your doctor and you aren't familiar with like medical terminology, you're going to have a hard time interpreting what it all means. And you might leave your appointment confused, and it won't benefit your health as much as it would have if you had that health literacy, or if the doctor's office explained it in a different way. Another really crucial factor is safety and walkability, like in the second column. And with that, often physical activity is like a big recommendation for what to do to improve your health. But what happens if you can't go to the gym, either because you can't afford it or because it's too far? And what happens if the nearest park is run down and you don't feel safe walking in your neighborhood? This kind of just demonstrates all of this. Another big one is food and access to healthy options. Next. Okay, so food deserts are a really big thing in Stockton. We see this a lot. There are so many fast food places around us, but the nearest grocery store is so many miles away and you have to take like a 20-minute drive to get there. This map on the left, it shows all the supermarket locations in Stockton, and the map on the right, it shows the service ratio of supermarkets per 10,000 people. So the green areas are where there's good pedestrian access to supermarkets. And as you can see, there are very few green areas. All the orange areas are where there's limited but all right pedestrian access, and all the red areas are where there's zero pedestrian access to a supermarket at all. So you have to take a drive. And when you look specifically at the census tracts that are red on this chart, a lot of those neighborhoods are in South Stockton, and those neighborhoods are more likely or are less likely for the people living there to have as many options for transport, like as many cars. So it's more difficult to travel to those supermarkets when they're far away as well. So public health is meant to protect and improve the health of the community through education and policymaking. So all of these things we just talked about, like walkability, like food access, all of those are contributing factors. So what this is saying is, to improve a health issue and to we have to reduce those contributing factors first. I just want to say to try to remember to think with this framework as we're going to go through a few health issues which impact Stockton, and try to think about these contributing factors and what we as a community can do to try to help reduce them.
Real quick in the chat, I saw people mentioning the gym. I was just talking about this too. I've seen people who can't afford automobile access who have to walk to make it to a grocery store, but then there are other people who can afford a gym membership and they pay to access a building to walk inside of there. So that's another interesting like contrast. So today for this outline, we will be talking about asthma, its symptoms, triggers, and mitigation, in addition to diabetes, its prevention, and the importance of early screening. We'll also touch very, very briefly on mental wellness and community efforts to make a change in all these different aspects. It's going to be a lot of information that we're trying to pack into the last 14 minutes, but we're still going to get into it. If anyone has questions, we will have time at the end too. Okay, if you want to answer again in the chat, if you're comfortable to, do you have asthma or does anyone you know have asthma? Okay, so what is it? Asthma is a chronic condition usually caused by someone's genetic makeup, but it can be influenced by the environment you grow up in. Asthma symptoms can result from blockages in airways like constricted air passage muscles or too much mucus being in there. It is not curable, but we can help lessen the impact of symptoms on your lifestyle. Here are just a couple of asthma symptoms. They can help you prepare if an attack is oncoming. Signs and symptoms include chest pain, trouble breathing, and coughing. And as we've said before, or if you were in Carlane's workshop earlier, because I see some familiar faces that were there, asthma is a relatively common in Stockton. To help us understand how much it involves our community, here's a few facts. Stockton's asthma rates are number 2 in all of California, and we rank 63rd in the entire nation. 1 out of 5 children in the San Joaquin Valley has it, and low-income areas are more likely to go to the hospital for treatment. So why is it more common here? We collect pollution from many factories, freeways, and fires that contribute to higher rates. Certain groups are harder hit from very inequitable situations like redlining and just the neighborhood you end up being born into. How do we deal with asthma? You want to identify triggers in your environment, look into medications that are right for you or for the person that you know with asthma, develop an asthma action plan, and more. So for the action plan, this should only be done with your doctor and with the people who are around you so that can help them prepare for when an attack happens and help you get better treatment. Yes, and sign up for the Dawn program. Okay, here are just some few asthma triggers common in our environment. These consist of things that could trigger an allergic reaction, like say pollen, dust mites, smoke, or things that irritate your airways, like strong chemicals, pollution, and even sometimes your reaction to stress. And just to list a couple ways you can decrease your exposure to asthma triggers. Go ahead and read them if you can, but just to keep it short, the general theme is to keep your spaces well ventilated and clean. In addition to this, avoid firsthand, secondhand, thirdhand smoke, any of that. Check air quality. This information is available online and even on some weather apps on your phone. Okay, so that was just a very brief introduction into asthma and issues surrounding it, and other ways as an individual, what you can do to help with someone's or your own asthma symptoms. We as individuals can also work as a community to fortify the environment against asthma. These are a few programs to help put up air quality monitors, provide asthma and environmental education, and deepen green spaces in our area. These include Little Manila's Dawn program, the San Joaquin Valley Air Collaborative, they're the ones that are putting up air quality monitors, and urban forestry, greening, and gardening nonprofits like the Black Urban Farmers Association. So that's the end to our brief overview on asthma. Malia can take over for our next topic, diabetes.
Thank you, Malia. So diabetes is another major health concern in our community. While this might seem kind of like a big shift in topic, try to notice like the similarities in how we as a community can help decrease diabetes in our community. Okay, so just to explain, if anyone doesn't know how diabetes works, so normally when our stomach digests food, the food breaks down into glucose and that goes into our blood. And normally the pancreas produces insulin, and insulin helps the glucose get inside our body cells, like for example, muscle cells, so our body can use it as energy. But with type 1 diabetes, the pancreas doesn't make insulin, or it makes very little insulin. So the body's cells, without that insulin, they can't absorb that glucose. And that leads to that glucose building up in the blood, which makes you have high blood sugar. Type 2 diabetes is similar, but instead the pancreas does make insulin, but the body's cells develop insulin resistance, so they don't respond to it the way they should. And it leads to the same problem as type 1 diabetes, because your blood sugar levels end up getting high since glucose can't get inside the cells to be used. This also explains why people with diabetes might feel fatigue and low energy at times. Okay, so these are some complications which can result from diabetes over time. And it's kind of just to show how serious it is and how important it is to have access to timely, well-coordinated prevention, screening, diagnosis, etc. Because if you don't receive adequate care, unfortunately, diabetes can lead to more serious conditions like blindness, skin diseases, depression, TB, kidney failure, and risk of serious complications from COVID. But like it says at the bottom, it's really important to understand that all of these are really preventable as long as you have access to be screened, to be diagnosed early, and to have timely care. Okay, so this slide shows on the right, you can see about 1 out of every 11 people has diabetes, and 1 out of 4 of those people don't even know they have it. That's like vital time during which they could have been receiving treatment and preventing the comorbidities we talked about on the last slide. And to go on, 1 out of every 3 adults has prediabetes, and 9 out of 10 of them don't even know about it. If they were getting screened, if we increased screening rates, and if they had access to adequate timely screenings, they could have had an easier chance of preventing that prediabetes from developing into type 2 diabetes. Because without moderate physical activity, then there's a higher chance of that prediabetes developing into actual diabetes within 5 years. Okay, so how much of an issue is diabetes in Stockton? Half of adults in Stockton have prediabetes and 10% have diabetes. There's also a big shortage of diabetes care providers. And there's also just a general shortage of healthcare professionals. A lot of parts of Stockton have a shortage of primary care doctors, and San Joaquin County, it also has a shortage of registered nurses. And also there's only 1 certified diabetes educator for every 1,600 patients who need services. And all of these, they're all heightened health challenges which make it harder in Stockton, depending on where they live. A lot of these challenges are poverty, lack of access to healthy food, like we talked about earlier, easy access to unhealthy food, and a lack of safe places for exercise. These are all contributing factors which lead to the higher obesity and diabetes rates in San Joaquin County and in Stockton. So this might all seem really bleak, but we can do a few things to step up to try to fix this. First, number 1, we need to implement greater diabetes education for healthcare professionals. Considering where we live and considering that diabetes is a bigger health challenge where we live, it's really important that we look to that. UOP has taken a big step toward this by starting a program where they're giving scholarships to nurses studying there so they can learn more about diabetes, and then they'll work in Stockton for at least 2 years once they graduate. So that's a really big step. Another thing we need to do is improve healthy food access and also increase community knowledge about diabetes. We can do this through health promotion programs, which we're going to talk about in the next few slides. Okay, so what are some ideas for health promotion? Okay, so one major step we can take is improving healthy food access. We need to try to make healthy eating fun. We can do this through more active community gardens like Edible Schoolyard here in Stockton. Another idea would achieve more community engagement. It would be something like a diabetes conference or a workshop. It could have nutritionists or volunteers sharing advice about how you can prevent diabetes and how to eat healthy. It could even provide free cooking lessons for healthy recipes that are good for preventing diabetes. We also need to make exercise easier. We need to create safe places for physical activity that everyone can access. We can encourage biking through signs, incentives, better biking infrastructure. And we also need to push our cities to invest more in our parks. As individuals, we can just volunteer for park cleanups, but as a community, we need to push the city for improved park maintenance, taking better care of the parks, increased urban greening, etc., so that we have a free and safe place for the community to be healthy, which is what a park should be. This might seem like another shift in topic, but mental health faces a lot of these same challenges like limited access to mental health providers and lack of coverage for mental health services. Mental health is a big issue in San Joaquin County. It has a lot higher indicators of poor mental health. And it's also important because it directly affects your physical health and it's essential to well-being. And so these are some goals that we can try to accomplish to tackle the structural issues and improve mental health care access. By increasing the number of doctors available, healthcare professionals available. We also need to actively talk about these issues so we can reduce the stigma and be able to reach a place where, like we were talking about on the slides about health promotion for diabetes, to increase access to good nutrition and physical activity. And we also need to increase awareness of resources available like the Gleason House and Community Medical Centers, NAMI, which stands for National Alliance on Mental Illness, Pacific Clinics, etc. Next slide, please. Thank you. And for tying it all together, I hope you guys take away from this presentation that all of these health issues are very interrelated and we need to start from somewhere and to reach a healthier Stockton. And thank you so much for listening. We would really appreciate it if you give us any feedback. And that's the link, tinyurl.com/lmstocktonfeedback. And our contact information is on the next page if you want to take a picture of it, if you guys want to ask us any questions. Sorry, we're a bit short on time for questions in here. Yeah, thank you so much for listening.
Yeah, thank you for coming.
I really enjoyed your presentation. It was really awesome to hear about kind of diabetes and health promotion and mental health. And mental health is 100% related to everything else. Okay, cool. It looks like we have like a minute, but thank you for the presentation, Malia.